Good afternoon and welcome to Mehta Talks, a talk show with a medical twist where we talk about common health issues, illness and health imbalance, and how we treat it with Ayurveda with our own expert, Dr. Anil Mehta. Today we talk about high blood pressure, also known as hypertension. Dr. Mehta is an Ayurvedic expert with 40 plus years of experience and has written more than 35 books. He has his own clinics and not to mention his own schools in the Netherlands. He is our main guest today. If you have any questions about this show, this topic, or just a question for Dr. Mehta, please feel free to call us during our show. Our lines are open and you can call us at our free number 003170319256.
Yes, thank you for your introduction, Reshma. And it's time, first of all, to introduce our home expert of today, Dr. Mehta. Welcome.
Thank you, Julian. Thank you, Reshma, for introducing me. You see, Ayurveda is made of two words, Ayur and Veda. Ayur means life, Veda means knowledge. It means knowledge about the life, specifically about the healthy life. How you can be 100 without having any problem. That is about Ayurveda.
And it treats you well because you still look like you are in your...
That's true, because for Ayurveda treats me well.
I think we have our first caller.
Great. Good afternoon. Who am I speaking to?
Good day, this is Mr. Kapoor from the UK.
Did you know, Mr. Kapoor, you are calling us before Dr. Mehta actually explained what high blood pressure is?
Yes, I know, but Reshma said that if you had any questions at all, I could call.
He's right. Absolutely true.
Okay, fine. You can ask, but no questions about the bank details of Dr. Mehta.
Don't mention him. He's just acting funny.
My question is for Dr. Mehta, of course.
Tell me, Mr. Kapoor.
Dr. Mehta, you talk about Ayurveda like it's some kind of scientific and medical treatment, but isn't it just a way of life, like more spiritual?
Yes, good question, Mr. Kapoor. I would like to tell you that Ayurveda is not only spiritual, it works mentally, physically, and also spiritually. So the Ayurveda is based on observation and 5,000 years of experience. So Ayurveda is a complete science.
Mr. Kapoor, does this answer your question?
Yes, it does. Thank you.
Thank you for calling, Mr. Kapoor.
Yes, thank you so much for calling and have a good day.
Thank you. Bye-bye.
Julian, the topic of the show is high blood pressure. What do you know about this illness?
Well, nothing really, to be honest. But I did my homework. I learned that high blood pressure is like a silent killer. You don't mention any symptoms until you have serious physical damage.
Yeah, it just sounds like a snake.
Yeah, it's like
a
snake attack.
Snake? What do you mean?
I'm sorry, Dr. Mehta.
I'm sorry.
But if you take a look at how snakes are actually, when they strike sudden and silent.
Yes.
I bet that too. If you go to your GP with snake around your neck, obviously he will see and take care of you. But in case of hypertension, it's not like that.
Okay, that's right. So it's a bad comparison.
You see, 1 out of 10 Europeans, they are having high blood pressure and they are not aware of.
I see. But doctor, what is actually high blood pressure?
You see, to know high blood pressure, one must know what blood pressure is. Blood pressure is a force of the blood against the wall of the artery, with which force it's coming. That's the blood pressure. Everybody has to have a typical blood pressure, but it's dangerous only when it's more than required. If force is much more against the wall of the artery, it can damage that, and that can get you fatal disease like a heart attack, stroke, paralysis, things like that.
So it's very important to realize that you have high blood pressure. But how can you check it, especially in an early stage?
That's why in beginning of the show I said that one should take responsibility of his health in his own hands. He should go to GP regularly. He should get his blood pressure checked.
Doctor, I'm sorry, but isn't it impossible for people living busy lives as nowadays in Europe that we are going frequently to check our blood pressure at the GP? It's impossible. We don't have time for that.
You can have blood pressure monitoring system yourself at home and check yourself once a week, once a month, once in.
That's true. Well, thank you, Dr. Mehta. I believe we have a caller, a young woman from Holland. Please, good afternoon.
Good afternoon, this is Jessica.
Hi Jessica, where are you from?
Oh, goedenavond, Jessica.
Goedenavond.
Dr. Mehta lives in the Netherlands, eh?
Absolutely. Jessica, I do have to ask you to ask your question in English because we have viewers on an international level. That way everyone can understand your question.
Yes, I understand, no problem.
Thank you. So, your question.
Sometimes when I wake up in the morning, I experience pain at the back of my head and neck, which soon disappears. Can this be high blood pressure?
Yes, Jessica. I would like to tell you that certainly this is not hypertension. Generally, people getting up early in the morning with stiff neck and pain in the neck is because of the posture problem. Whole day we have got a typical posture, we work like this, having a posture like V form, and at night if you use high pillow, that makes obstruction in your blood flow, and that is generally the cause. So, what I will advise you to go to your GP, get your blood pressure checked, and that will help you a lot. Or go to any good shop where you can buy a special pillow of having that form of the body. So, if you sleep on the body on that pillow, that will take that shape, and that's going to help you.
Dr. Mehta, what can people do if they have the symptoms of high blood pressure?
Yes, it's a very good question. You see, blood pressure by one person is different than blood pressure by other one. So, if you have blood pressure, reason can be different totally than if you have blood pressure. So, we have to see the reason behind, what the reason is. Reason can be smoking, reason can be because of overweight, reason can be hyperlipidemia, metabolic disorders, lifestyle disorders. So, there are so many reasons. So, to treat something in Ayurveda, first we have to eradicate the reason. That's why you have to know what the reason behind is.
And what about stress? Is stress a cause?
Stress is one of the factors.
And so what can, because many people are living a really busy life and have a lot of stress. So what can Ayurveda do for them to minimize the cause of stress?
Yeah. You see, stress is lifestyle problem. So whensoever we have much more to do than given time to perform, then stress occurs. It means in 24 hours you can't work for 25 hours. So you can work according to the given time only. So that's why Ayurveda says you must perform your agenda. You must keep your agenda.
But Dr. Mehta, that's easier said than done because I'm a mom of 3 children and with work, believe me, it's a hectic life.
Now, you have rightly said that there is much more to say. Exactly that was my point. So, I say according to Ayurveda, if you have 24 hours a day, so then take half an hour for yourself. That half an hour should be for yourself totally. Do meditation, do few breathing techniques, pranayama, yoga.
Okay, but how should people meditate? Many people don't know how to do it.
You see, meditation can be learned. There must be schools or yoga center in their neighborhood, or they can just come to our clinic. We will teach them how to meditate. You see, meditation is a very little technique. How to keep your mind away from all the issues. That is a technique, and that can be learned.
Everybody can learn it.
Everybody can learn.
Even I.
You can learn too.
Of course, why not?
Lucky me.
Besides yoga and meditation, what else can be done?
Yes. Much more can be done by the patient himself.
Yeah.
You have to know yourself. Person should know his own constitution. You see, you work in your constitution maximum mentally and physically. If you know your constitution, if you know what are good things for you, you should know what are bad things for you. You should know your aversions. You should know your likings. If you behave according to your constitution, then lot more problems you have sorted out yourself.
We have a new caller, and I believe from Germany. Good afternoon, who's speaking?
Hello, can you understand me?
Hello, who is this? Can you hear us? We hear some kind of echo. Maybe you should turn off the television.
Yeah, that's a good one. Could you turn off your television?
Hello, now I can hear you.
What's your name?
My name is Gunther.
And where are you from, Mr. Günther?
I'm from Germany, from Stuttgart.
Wow, hello. Stuttgart, do you have a question for Dr. Mehta?
No, actually I don't.
So, why are you calling then?
I have a question for Reshma.
Oh, shall I take a break now?
Okay,
So, Mr. Günther from Stuttgart, what is your question for Reshma?
I have not really a question, but more like an advice, because she was telling about busy lifestyle and stress, and what I do, what helps me is doing sport. You should try doing sport.
really? Well, thank you for the
Oh,
advice.
that's a good one.
Yes, absolutely. Well, I love to, but indeed you need to have time to do that. But that's a very good advice.
So,
Thank
you are
you.
paying attention on the physics of Reshma, right?
Julian,
I'm making it worse.
you're making it worse, definitely.
No, but you should try do some physical exercise. You will thank me later for that.
Well, thank you, Gunther, if I pronounce your name right. Thank you for calling and thank you for your advice.
Dankeschön. Tschüss.
Dr. Mehta, I know you want to take a break, but is there a solution for losing weight?
I will tell you, since our topic of today is hypertension, and exercise has to do lot with hypertension.
I see.
So, exercise is one of the biggest factor what can help you reducing hypertension, and above all, not all the games, but walking. Walking every day after having food, that's going to help each and everyone. It's a sort of meditation. If you have a long walk, it works
So,
as a meditation.
so walks can actually reduce stress after having a long day.
Oh yes, I'm very much sure, and lot more test has been done on this, that long walk works as a meditation. That's not only good for your obesity, but also for your mind. So it gives you rest, peace, enjoyment, answer to your unsolved questions you get with meditation. That's what you are going to get.
Well, thank you. Thank God you.
So I will recommend you Reshma as well.
Well, thank you.
meditation.
I'm glad you didn't take that break, really, because this answer really helps me a lot. Well, thank you, Gunther, and hope you enjoy the show. Good afternoon.
Dankeschön. Tschüss.
Cheers.
Thank you.
Let's get back to the main subject, Dr. Mehta. We were talking about high blood pressure in combination with Ayurveda. We talked about yoga, meditation, lifestyle improvement,
Physical
health,
exercise.
yes, of course, physical exercise. But are there any other solutions? For instance, diet.
Ah, yes, diet. What about diet?
Very, very good question. You see, diet can play a very important role. As in beginning I told you that blood pressure is the force of the blood on the arteries.
Yes.
That force is coming on the wall of the artery wall has to be very, very strong. So therefore we need a special type of food that are essential fatty acids. Essential fatty acid is what we call HDL. HDL is a high density lipids. Lipids of
High
very
density lipids.
yeah, that's the lipids of very, very good quality that makes our wall of the arteries strong. So that's in Indian food, we generally use ghee. Ghee is clarified butter. Every Indian knows. But
That's
now
very
in
nice.
Europe also we are using that one. So that fat is so important. If you don't like that fat, you can have essential fatty acids like omega-3, vitamin D3. These are of very good importance. Besides that, I am going to tell you that garlic is one of the natural blood thinners. At the same time, it's against the cramps, cramps of the coronary
Yeah.
vessels.
Yeah.
So if person takes garlic regularly in his food, so that will work as a blood thinner. It's going to work against the cramps what in the heart diseases patient generally get. And in food, what more important is to have potassium and magnesium every day in adequate dose.
So all our viewers should go on a diet of ghee and garlic, right?
Yes.
So only ghee and garlic from now on, guys.
Yeah. But besides that,
But-
I'm telling you potassium and magnesium. Potassium you get from the banana, and magnesium you get in high dose from the spinach.
Spinach.
So one should have regularly adequate dose of magnesium and potassium in their diet.
So that's a lot of paneer.
A lot of paneer.
Okay, so
Right.
from now on, I'm only
Banana.
going to eat garlic, ghee, spinach and bananas only.
And not to forget
you.
a regular journal lifestyle. So you have to go to bed early, you have to have sound sleep, you should know yourself, you should avoid anger, you should make your agenda, and so that mind should not get in a position to get angry. So it's an important lifestyle. So yoga meditation helps, good
Especially
food
for
helps.
Rishma, you should sleep more. You hear it?
Yeah.
Sleep more.
Yes. I think we both should actually, well, we shouldn't. We have a lot of homework to do, don't we?
Yeah.
That's true.
So as
We
in
have a
beginning
lot
I
of
told
homework.
you that
Yeah.
health is in your own hands. You should take that responsibility for yourself. So food, lifestyle, all together makes you happy, healthy, lucky.
Well, Dr. Mehta, thank you for everything, your expertise, your answers, your advice.
Oh, it's all my pleasure.
Thank you.
But we still have a lot to learn, so keep watching the series.
Thank you. Absolutely, you're absolutely right, Julian. Thank you a lot. I hope you enjoyed the show. See you next time at Mehta Talks.